If you think you pay too much for prescription medications, you are going to want to hear what we're going to talk about today. Joining me is Dr. Dan McCoy. Dan is former president of Blue Cross Blue Shield of Texas, so he knows a little bit about the prescription healthcare business and also a lot about pricing. He is also now a healthcare consultant. I'm going to talk to him later about why he decided to become a healthcare consultant as opposed to working in the industry. But first of all, Dan, thank you so much for joining us this morning. I've had just a tremendous amount of interest on my social media about healthcare and Medicare, all kinds of health-related issues. So thanks for being with us.
Well, thanks for being here. I'm excited. This is something that I enjoy talking about, and I don't think there's enough light being shined on these issues. There's confusion, and the system is meant to be confusing. And I think if we can shed some light on it, I think it'll be great.
It's incredibly confusing. So I just want to start out. Give me an example of what you're talking about. When you're talking about what we're going to talk about is what you call a scheme, really, to take a lot more money from people than needs to be taken when they go buy generic drugs. So give me the example to start out with.
Well, first of all, I just get annoyed when I hear about things that are raising healthcare costs, and they're just stupid. I mean, they're absolutely just stupid. And probably the most classic example is generic medications. If you walk into your pharmacy and you ask for a simple prescription, and let's pick one that everybody knows, like Lipitor, okay? You may be told that's a generic medicine, but the bill might actually be something like $60 or something. But what you don't know is that medicine may have only cost $1.46 to actually make. So look at the spread here. It's crazy. Now, don't get any ideas. I'm not pointing fingers directly at CVS because that's not what's happening. There is actually a middleman, and a middleman called a PBM. And the PBM negotiates a price and a rebate from the manufacturer. They go over and they negotiate what they're going to charge the health plan, and then they negotiate what they're going to charge the pharmacy. And at the end of the day, the health plan pays a huge amount. The pharmacy gets paid a little. The manufacturer gets paid a profit margin. And that middle spread pricing is just put in the pockets of the PBM. And to be honest with you, there's really not a lot of added value. It's just theft.
You know, I know about these PBMs and just exactly what you said. The pricing structure is so confusing that I personally just give up. It's like, I can't understand that. I'm not good at math. I don't understand all this. Let me just ask you this question. You've been inside the insurance industry. Have you seen pricing manipulation happen inside the insurance industry?
Well, I don't want to use the word insurance industry. Let's just talk about healthcare in general. Healthcare in general is confusing. I'm absolutely very much a skeptic. I think it's confusing by intention because the more confusing it is, it's hard for people to understand. And when people are involved in the healthcare system, it's often when they're sick. They're searching for answers. They're trying to get health care. It's really not the time to solve a problem. It's kind of like the airplane's crashing, and now we're going to figure out what the design was flawed. We actually need to be thinking about it proactively and that sort of thing. So PBMs are really kind of a good example. We hear that word PBM and people don't really know what it means. It stands for Pharmacy Benefit Manager, and it dates way back to the 1960s. The idea being that you could have a manager that would serve as a middleman between the manufacturer and the end consumer. Now, the idea here is that it would help to manage your healthcare benefits. But
Sounds reasonable.
Yeah, reasonable, but really honest with you, it's just not what's happening. Basically, what they've done is they become profit engines. So when you hear things like, well, Dan, be careful. You can't shut down drug prices because if you do, you'll cut down innovation. Well, let me just tell you, there's no damn innovation occurring in the PBM space. It's just taking money out of your pocket and putting it into Wall Street, probably.
This PBM is sort of a middleman that's gotten in the middle woman, whatever, and is basically just grabbing a lot of money out of the system. How much are we talking about? Like, I know you said something about like a drug that costs $2 to make has a $3,000 markup? Is all that going to the PBMs? Explain that to me.
No, I mean, it's not all going to the PBMs, but certainly the manufacturer, it may cost $1 to make. Let's be honest, they're going to have to make a little bit of a profit, right?
Right.
But in the insurance company, they're going to have to pay the bill for all of this. So they're going to get charged for that. But in that $1.46 example, it wouldn't be unusual for the insurance company to be charged $60. So you can start to see the issue here. Now,
So the insurance company gets charged $60 for something that cost $1.46 to make.
that's correct. Now, the
Who gets
PBM,
that
in
money?
fairness, the PBM has to pay the pharmacy, right? But they may actually pay the pharmacy something. They may charge the pharmacy. So they may charge the pharmacy like $20 or something to make up the difference. But the kicker here is that the end consumer might get charged, $40, $50, but that middle $40 or so, it's going to the PBM. And really for not a lot of value today, not a lot of value, particularly on generic drugs.
Because the PBMs say that they actually save money because of all their rebates and all this kind of stuff. But you're saying that is, in the end analysis, that's not true.
Well, it's real easy. Show me the math. That's all I'm going to ask you to do. Open up your books, show me the math, be very transparent on how you are saving consumers dollars today with the PBM. And I will be the biggest convert. If you can show me how you're saving a consumer money by putting this middleman in the middle, or middlewoman in the middle, however you want to tell, whatever negative thing you want to say about it. If you want to do that and you can show me how that saves money and helps consumers, I'm all in. But all I'm looking at is the tremendous profits that are coming out of PBMs. So they become very profitable engines in a world where healthcare costs are going up. Consumers are finding healthcare unaffordable. So for me, I don't believe it.
Because like I said, I'm not really great at math, but let's say $100 is like the total price of the drug. So you're saying, what is the pharmacy getting? What is the insurance company getting? And I don't even know if I'm phrasing this right. Well, out of that $100 that you end up paying for a drug, well, I'm just picking 100 because it's an easy number to understand. How much of that 100 is that PBM layer actually getting?
Yeah, so let me kind of walk you through this. Let me walk you through the example that we've already done, Lipitor. Okay. If the drug costs $1.46 at the manufacturer, okay, then a high deductible health plan like me or you that goes in the pharmacy, we might pay $46 out of pocket. Okay, that's the 3,000% markup that I was kind of talking about. The PBM will negotiate a rebate with the manufacturer, okay, somehow. So they'll figure out a rebate system. They'll charge the insurance plan $60. They'll pay the pharmacy $20, and then the patient with their copay, it's $46. So you can see that $40 in the middle all went to the PBM. So that's basically the way it works. The PBM profits the middle part of that stream only for really managing the transaction between the manufacturer, the insurance company, and the pharmacy.
How did we get here?
Well,
why is this like this?
Well, in 1960, when these were first established, it was thought that they would help be managers, and in fact, pharmacy benefit managers. And most of that, if you think about it, healthcare back in the 1960s was kind of limited to doctor's visits and hospitals. Healthcare was pretty simple back in those days. Wasn't as complicated. There weren't as many players. The drugs and treatments weren't as expensive. So drugs were kind of a difficult thing to understand. They didn't really fit into if you think about it, the normal system. And this is not uncommon. I mean, mental health benefits didn't fit into it. I mean, it wasn't until recent legislation in the last 10 or 15 years where we've kind of put all of medical things under one umbrella. And so pharmacy kind of was sitting out here by itself in this own kind of system. And we saw this explosion in the cost of drugs. Don't think people today understand how much of their premium dollar is devoted to pharmacy. But it can be up to 25 to 30% of your health insurance premium is actually spent on pharmacy. Pharmacy has really absorbed a huge amount of the cost of what your healthcare dollar goes to.
You told me, I think that I've got notes made, 3 companies control 80% of prescriptions. How is that possible? Don't we have antitrust laws?
Well, we do. And I'm not an expert on antitrust, and I'm not pointing fingers in any company, but let's just say that, technically they've still been able to establish competing businesses. And I won't go through all of the ins and outs, but CVS, for instance, they still own pharmacies. Express Scripts, they own different mail order facilities. So these are different kind of entities. Opta, which is part of United Healthcare, right? So it's kind of a different system. So the result is kind of the same, but there's really no real competition. There's no price transparency. There's no accountability. I mean, the FTC is finally starting to look here a little bit, but keep in mind, this industry is incredibly well lobbied, right? So there's a huge amount of lobby spend in DC to help kind of keep this confusing system in place.
Because what you're describing sounds like to me that everybody at the top, the big pharmacies, the big drug makers, are all benefiting from this system that doesn't help us when it comes to paying for drugs. And so what I was going to ask you when I said, how did we get here or why are we here? You just alluded to what kind of money is spent on lobbying to have this system in place.
Well, again, I'm pulling this number out of my head, but I'm pretty darn close. It's about $100 million every quarter. So $300 or $400 million a year. And I don't know if this number is true because I never let facts get in the way of a good story, but I'm going to say about a third or maybe 20% of all lobby spend in Washington is spent by pharmaceutical companies or in the pharmaceutical industry. So a huge amount because you can see these are billions of dollars at stake in this industry. So not making changes like not adding, opening up the windows and seeing more transparency, getting rid of spread pricing, allowing us to understand what drugs actually cost to the consumer for a, manufactured drug, putting in place some simple profits, but at the same time to encourage innovation, but to take this extra money out of the market. Yeah. A lot of people are going to lobby against that because there's a huge amount of money being spent in those systems.
You said, I think, that Texas specifically has some of the highest generic drug prices in the country. Why would that be?
Well, Texas has always prided itself on a free market, but the PBMs have actually created kind of the opposite of a free market. For a lot of reasons, we've got limited pharmacy options in rural America, particularly rural Texas, right? And that even gives the PBMs more leverage. We have a lot of high deductible health plans in Texas. That means more patients are really paying full retail price for their drugs. And then, frankly, we have just not engaged in state regulation at this pace at which I think we need to on PBMs.
Me, your drugs here. Talk to me, if you can, a little bit about who gets hurt the most in this system. Are we talking about seniors? I mean, I'm kind of sensitive to that area because I just started Medicare. It's a whole new world to me. Are we talking about seniors? Are we talking about people with chronic conditions? Give me some examples of the kinds of problems we see for people.
Well, that's actually why I'm so passionate about this whole thing. The sickest people are going to pay the most. That's the cruel irony of a system that's really supposed to help manage healthcare costs. If you're healthy and you rarely need a prescription, you might not even notice a PBM. But if you're a diabetic, if you have heart disease, depression, chronic conditions that require multiple medications, you're funding this entire system. So seniors on Medicare Part D, people with high deductible health plans, anyone who hits that donut hole you may have heard about, they're paying full freight while the PBMs are going to collect billions of dollars in hidden profits.
You're a doctor. Have you personally talked with patients who've had to choose, like when we talk about Medicare or people who are seniors on a fixed income? Have you personally talked with patients who've had to choose between these medications and other necessities?
Well, probably because I'm on social media a lot and I post about these kind of conditions a lot. I hear about it every week. So every single week, somebody will send me a direct message or a message on social media. And I've heard from, diabetics rationing insulin, cancer patients skipping doses because they can't afford a $300 copay, elderly folks cutting pills in half so they'll last longer. But the most heartbreaking story recently was a woman from Austin whose antidepressant went from $15 to $85 overnight because her PBM changed her formulary. And she said, Dr. McCoy, I can't afford to be mentally healthy anymore. That's when you realize this really isn't about healthcare economics. It's really about basic human dignity and reforming a system that would, at the end of the day, is offering no value.
Get to what ideas you have on what we can do. But, one person that we all know has done something. So is Mark Cuban. Is Cubans what he does? Is that addressing some of this? And if so, what is he doing and why aren't more people doing what he is?
Well, first of all, a Cuban's model is brilliant, and it's brilliant in one way. It's very simple, simplicity. Transparency will destroy profit margins that are built on confusion. And that's really what Mark Cuban set out to do. So in his program, actual cost plus is really 15% markup plus a $3 dispensing fee. So no hidden rebates, no spread pricing, no games. A 90-day of that Lipitor might cost $6.60 instead of maybe $138, $140. But the established players have really too much invested in the current system. So they would rather lobby against transparency than actually compete on actual value. But Cuban system is really a fantastic way to go.
Is it that Cuban is willing to make less money?
Well, I think Cuban has to be able to create a business, right? And I recognize that too. You've got to be able to have the infrastructure to deliver the drugs. But I think the way Mark Cuban's approached it is we're going to be very transparent about where those profits come from, what they are, what the costs are. And what's really interesting, I don't know if this was intentional or not, but the 15% markup is really what the regulations are on most insurance products. So most insurance products have something called medical loss ratio, which means about 80 to 85% of it has to be spent on actual care. And that really lines up exactly with what Cuban's doing on the drug side. So to me, I think it's incredibly fair. I think it's incredibly simple. And I think it's incredibly transparent. And those are really the kind of reforms that would really work in this industry.
For a lot of people, and I mean, that includes probably people, at least the way I have been in the past, you think to yourself, well, everybody gripes about the prices and all this, but America has all these great innovations in medical technology. And the companies will tell you they have to have the system this way in order to continue to have innovation, in order to keep coming up with all these things. Is that a naive, to say the least, way to look at this point?
Well, I'll be honest with you. Let's pick a drug I'm really familiar with as a dermatologist, doxycycline. Okay. So doxycycline in some markets went from a generic drug that's been available since probably the 60s, right? I had patients that would tell me that they got generic pricing on this drug that was $80 to $100. Let me ask you a question. How much innovation is happening on doxycycline? So first of all, I think that's horseshit. I don't believe it. I think that's just a way to scam people into thinking that those dollars are actually figuring out a way to solve cancer. That's just not true. Most of that money is being put into the pockets of PBMs and people who are harvesting from people who are sick that are paying for these medicines. Now, don't get me wrong. I do like innovation, and I do think we need to be putting money into innovation, but it needs to be transparent. And I think we're not really seeing that. If you told me today that we were going to take profits from PBMs and funnel more of it to research and residency care and figure out ways to improve healthcare access, I'd probably say, let's talk about it. But if that's not happening right now, it's just being a profit center.
And the one reason I wanted to talk to you is because you are a business person. You're not what I would call, you're not just a person out here yelling about things and not understanding the industry. I mean, like I said, you were the former president of Texas Blue Cross Blue Shield. You actually know how the system works, and you're not anti-system in a lot of ways, which is why I wanted to talk to you about this. So what would you say? I mean, I don't even know where to begin. What needs to happen? I want to ask you first, what needs to happen? And then what can people do?
Well, I think, it all is going to start today with transparency. We really need to understand how these systems work. We need to get rid of much of the confusion. We need to understand where the hidden fees are, where the rebates are. We need the actual cost plus a reasonable markup. I think that's fine, but it needs to be published in real time. We need to know what the manufacturing cost is, what the pharmacy's markup is. Are there any administrative fees? I didn't even mention this a while ago, but the PBM actually charges the insurer an administrative fee and charges your local pharmacy an administrative fee. So there are fees built into the system that probably offer no value. And so to me, I think that's one step. The second part would be competition. We need more competition and not more complexity. I think that having Cuban's model as a part of the mix really helps to drive that competition, but there's a lot that needs to be fixed here. I would probably say you need to flush and restart. I think reforming the current system is going to be pretty tough.
So when you say flush and restart, I hear that as eliminating the PBMs. What would that do to the access to medications?
Well, I'm going to say up front, there would need to be thoughtful changes in the way that we got rid of PBMs. And there would certainly be people screaming about disruptions and all the things that can happen when people start to see their livelihood change. So that's going to happen. But I do think there would be potentially a reset of the system. Long term, I think you could eliminate them. And if you can eliminate that significant part of the cost, then seniors would pay less for money. People would miss their antidepressants. People wouldn't have to worry about making a copay for cancer.
It would work if we eliminated them. Why isn't that happening?
There's too much reason not to change it. I mean, there's lots of money being put involved in Washington to create this sort of keep the system the way that it is. And I'm going to let you in a little secret, and probably my most passionate thing about healthcare is that I want to eliminate the complexity. And you and I've talked about this before. The complexity breeds confusion, and the more people that are confused, then you can't change it. And so to me, we need to shine a light on what's happening within these systems. We need to simplify them down to their simplified areas. And that would be a way that we could actually find more money to fund innovation, pay researchers and scientists. But we don't really need to pay these middle people who are not contributing anything to actual healthcare outcomes in the long time. Maybe in the 1960s, it was a good idea. And maybe it actually served a function in the 60s when we didn't have the interconnectivity that we have today. But here's the problem. We can no longer, as a country, afford to have these kind of systems that add no value. We just don't have the luxury of doing that anymore because businesses can't afford to cover their employees with health insurance and people can't afford to pay their copays. So it's time to get rid of these things that are not adding value to your healthcare.
So that's all. That all sounds great. But I know probably everybody who's watching or listening to this is thinking the same thing I am, which is I give up. I don't know how to get anything done through any elected official because it sounds like lobbying is a big part of this. I have personally, on other subjects, written countless emails to senators, to representatives, and I get a form letter back. So how does this happen? What as an individual do?
Well, first of all, I'm kind of proud of you that you got a form letter back because I had a patient recently tell me that he has written 12 times to one of his lawmakers and has never received any fallback. So I do think you should be applauded for getting a response. I do think bringing awareness to these issues to lawmakers is actually incredibly good. I think work that you're doing about hosting these conversations, bringing this openness around transparency of the way the system is set up, I do think opens the doors. I think also encouraging people who are being innovative, encouraging people like Mark Cuban who are stepping out there and doing something different is actually the way that we have to reform the system. You know, I'd hate to believe that we're going to have to wait for a catastrophic event where, we can't afford, like all of a sudden we've reached a point where, we have to pull the trigger before we just kind of turn our brain on and realize we can figure out a better way to save money, lower cost, and be more competitive. And that helps business. And at the same time, we can do that to help patients get their care better.
While all this stuff is in process, is there anything I can do, anybody who is watching can do to protect themselves when they go to the pharmacy? I mean, are there specific questions I can ask a pharmacist? Is there something I need to do to protect myself?
Yes, there's some practical things you can do. And I'm going to sound a little bit like Dave Ramsey here. So just kind of hang with me. Okay. I'm going to talk a little Dave Ramsey. First of all, when you go to your pharmacy, and you walk up there to pay your copay, ask them for a cash price. So find out what it would cost if you just skipped your insurance. You had skipped that entire PBM connected scheme that I just talked about and figure out, would paying cash be cheap? And at the end of the day, maybe the pharmacy is not necessarily going to care because they're probably going to have this whole fee issue with your PBM and all kinds of things going on. The second thing is, I would personally check out things like Cost Plus Drugs from Mark Cuban. Check that out. Find out if that would be a cheaper alternative for you. Third, ask your doctor about options that might be cheaper. Don't feel bad about doing that. I've had a lot of patients say, well, if my doctor told me to take this is what I'm going to take. I don't think doctors are playing into the system to try to drive up your drug cost. I think they also are struggling with having the kind of transparency information on drug costs that we do. Everybody does, consumers, right? So ask your doctor, are there ways to manage your care that might be cheaper, more cost effective? Fourth, I'd call your insurance company. Demand an explanation when your prices go up on a drug. Demand it. Just call up, complain, ask for an explanation. Finally, contact your state rep. At the end of the day, this is probably a political problem. It requires a political solution. So talk to your congressman, talk to your state rep, let them know that you're being troubled and bothered by this issue. And maybe this kind of combination of effort will provide enough value for you that you can at least keep going until the system finally gets fixed.
So if you had, let's say you were going to get on television and you had 30 seconds to deliver a message to, as you said, awareness is important, what would you say?
I think it's, every time you fill a prescription, you're funding a system designed to make sick people poorer while making healthy executives richer. 3 companies control most of your medications. They hide their prices. They pocket billions of dollars in profits while you ration your insulin or skip your heart medication. So this isn't really healthcare. It's legalized extortion. So demand transparency, support reform, and remember, in America, you shouldn't have to choose between medicine and groceries.
You talked about contacting your representative, getting more information out there. Do you realistically see any hope of actually solving this?
I actually do, because I always have abundant optimism about the system. I do think it's complicated. I do think that it's easy for you to kind of fall into this boat of thinking that nothing's ever going to change in our lifetime. And don't get me wrong, from time to time, I have that too. But I do think there are some efforts going on. The FTC, the Federal Trade Commission, they've kind of gotten their eyes on this whole idea. So I think there's some investigations going on that are going to look at it and drive reform. That's notoriously very slow. And so I'm not counting on that to be the answer. One thing I think that's going to really drive this issue more than anything else is just the fact that greed has taken over, and the amount of money that's going into pharmacy drugs and cost. I mean, the pie is only so big. So when you grow the pharmacy cost to be a significant part of the pie, you're compressing what we're paying for physician care, for hospital care, for cancer care. Well, those groups are loud too. And I think at some point you're going to have a little bit of eat your young here, where I think you're going to have these groups starting to push back on this pharmacy system and say, look, we've got to work together to come up with a better system to take care of patients. And hopefully that'll happen sooner rather than later.
So why did you, I think it takes a certain amount of courage to be candid about this subject when you have worked in the healthcare industry for all of your career, I think. Why did you decide to talk to me about this?
Well, yeah, well, it's nothing new, actually. I've been working in this for probably 10 or 15 years. And I know I worked in an insurance company. People wonder about that. But at the end of the day, I've always been passionate about figuring out ways that could improve healthcare access. Now, and I think I'm just tired of being quiet. And, I've written about it a lot recently about all the system that's going on. And I think, my little group, and I have a group of what I call nerdy, former executives. We're all on faculty somewhere. We all like to talk. We've just kind of decided to tell the story, to shine a little bit of light. The system's incredibly complicated. And, I don't have a lot of depth, but as my dad would say, I'm a mile wide and an inch deep. I have seen a lot of these systems out here, and so many of them exist in silos. And because of that, people become experts in the silo. They really don't understand how to interact with other places. So the one advantage that I have, and actually the people that are in our group, we get to see the whole landscape. And because of that, we kind of see how these parts work together. And I think we've decided we've had enough. We're going to call a spade. And at the end of the day, we've got to make America healthier. And that's not going to start by raising copays, raising insurance rates. It's going to cost by cutting out waste. And we hear this thing, fraud, waste, and abuse all the time. And it always gets pointed at doctors and hospitals for doing unnecessary tests and doing unnecessary procedures. Well, okay, that needs to be done. We got to look at that. We're going to be fair about that. But the flip side is also true. When we're paying for middle people to just do nothing but manage transactions like a PBM, I would argue that's waste too, waste we can't afford anymore.
Sounds like to me, when I listen to you, it sounds like to me that fundamentally what's going on is there are a lot of lawmakers who are making a lot of money from the lobbying efforts of the pharmaceutical industry, that's at the bottom of a lot of this. Is that wrong?
I think it's complicated. And let me just be fair to tell you that, you're not going to hear this from a lot of people. And I know that I might get hate mail for saying this, but it's actually hard to be in Congress today. It's really,
I don't
it's
doubt
really
that.
hard. It's really
I
hard
don't
today.
doubt that.
And we've done some things in Congress which I think were really good intentions. Like we cut down on taking people out to dinner. We cut down on some of these direct lobbying efforts. So they fly in on Monday morning. They fly out on Wednesday night. They never meet with each other. They never connect. They never have any depth understanding. So I think it's complicated. But at the end of the day, I do think lobbying these systems for no change is probably the biggest impediment that we have for making reasonable change. It's just, it's the medical industrial complex. And there's a lot of cash that's being spent on lobbying, not really necessarily to pass reforms, but just to slow down fixing the system that's broken.
I'm going to ask you something that may be a little bit sensitive, but one of my pet peeves is seeing people get denials from insurance companies, repeated denials. And that feels like a stalling tactic to me, so that people eventually just give up. Do you have any regrets about your time in the insurance industry?
Well, first of all, denials are medical policy, right? So there is a substantial medical policy. Insurance companies don't have like a denial button that just gets pushed to save money. That's not true. It may appear that way. And I think when you're sick and you need a medicine and somebody has put their hand on your shoulder as a doctor and they've said, this is the prescription that's going to make you better, and then there's hoops to get through to get it paid for, it's very easy to see that system as being nothing more than just a gated way to keep you from getting your health care. I totally understand that, very sensitive to that. But the flip side, those systems are probably being put in place many times by the employers, many times by Medicare, many times by the government to say, you need to follow some sort of system before you just immediately hand off this expensive drug. Now, it may be that you need the expensive drug, and this is where the system's broken because it's hard to know who really needs it and who doesn't. And that creates, problems for the patient. But at the end of the day, the solution here probably is to make drugs more affordable. If drugs were more affordable, you really wouldn't need those systems anymore. This is really a pricing problem. It's really hard for people to, for people to understand that, but this is a pricing problem. Healthcare is too expensive today. If you lowered the prices of what we're paying for healthcare, it would by default become more affordable and more accessible.
Any regrets?
No. I mean, I don't have any regrets in the fact that everything that I ever did in my career, every single thing that I've done is to try to improve healthcare access by lowering cost and improving the ability for people to access health insurance and health care. So I don't have any regrets. If the only regret that I really have probably is not speaking up and being louder a little sooner. I've always been pretty vocal on healthcare cost, but I probably could have been vocal a little earlier in my career.
Anything I haven't asked you that you think is really significant that people need?
Well, I think the biggest thing to say is that, if you need a medication and your doctor recommends it, really work on trying to figure out a way to get it. And there are a lot of things we talked today about how to handle the pricing, right? There's some other things you can do too as a patient, which I think people just need to be aware of. One, there are often rebates that patients get. It's a complicated system. Not going to go into that, but you should ask your doctor, do you have a coupon? Do you have a way that I could get my medication a little bit cheaper? So as a patient, you can often reach out to a pharmaceutical company. I think many of the pharmaceutical companies understand this challenge of this system, and many times they're willing to circumvent the system, work directly with the patient, particularly on very expensive medications where they know that you're never going to be able to afford this medicine. So if we put up a complete impediment for you getting it with all this cost, you're just not going to take it. So they'll often work with you. So I think when you're sick, you probably don't feel like it, but you can get creative in a system to probably find some value. It's just unfortunate you have to do that work.
Thank you so much.
Thank you.
Lots of really, really good information. And you want to come on and do this again?
Sure. The problem is that here's the great thing, or bad thing, if depending with the perspective you look at it. This system in healthcare is just full of these. We talked about PBMs today, but you could talk about multiple areas where all we had to do was to remove the waste and there would be a dramatic improvement in overall cost.
So let me ask you this. If you had to pick a subject for us to talk about next time, something you think affects everybody, what would it be?
Well, I think probably side of service, monopolies in healthcare. I could walk down the list. There's a huge
Okay.
number of those choices to look at, but you know, I think we could probably pull anything. You could probably tap any system, whether you want to talk about the hospitals, the doctors, the insurance companies. We could probably pick any one of those, and we could find an opportunity to cut waste, fraud, waste.
Two quick questions. Where can people find more information? Where can they go for good information? And where do they find you if they want to ask you a question?
So sure. So the easiest thing to do for finding information is to start with the end user, because I think most of the time the end users are not part of the system. So your doctor is a fantastic resource. So go to your physician, do the things I said, ask them for ways to be, more efficient, cheaper cost of drug alternatives. If you're getting a lot of pushback on costs, see if they can write you a different prescription. Don't feel bad about calling the nurse and asking them to change your prescription. Just don't do that. Secondly, your pharmacist is a great solution. Most local pharmacists, they're kind of the end user in the system too. They don't really, keep in mind, they're having to pay the price of the PBMs too. So they're going to be willing to work with you. You might could go to your pharmacist and say, hey, this medicine's really, really expensive. Are there some alternatives? And the pharmacist is going to be able to say, yeah, this is a great to go. And the pharmacist might even help you with that communication with your doctor to back and forth. 3, reach out to your insurance company. Now, you don't even have to reach out to be a jerk. Just reach out to your insurance company and say, listen, I can't afford this medicine. Are there other options? And believe it or not, your insurance company can help you navigate that process too, because it may surprise you. They're probably an end user too in that system. So they're going to be willing to help you. As far as reaching out to me, you can find me online, reach out to me on LinkedIn. You can reach out to me on Instagram, all the social media channels, and I'm sure you'll put those in your show notes, and I'll be happy to visit with anybody.
Thank you so
Thank
much.
you.
Appreciate your
Thanks
time
for
today,
doing
Dan.
this.
Thank you.
Have a great day.
And Dan, I think, is going to do this hopefully every Wednesday with us for a while. So hopefully you will join us again for that. And that's our live show today.
Thank you.
Thanks.